Hello, I'm Matt Schwartz, Chair of the Worksite Wellness Council of Louisville, here with Sharon Boost, who's with On Life Health, and we just had a great conversation about telemedicine. Telehealth, actually, is the new term. So give me just a quick, what is it?
It's accessing care virtually using a smartphone, a computer with a webcam, or even a tablet, and you're accessing the care when you need it. It addresses acute conditions like cold, cough, flus. It's an extension of your primary care physician when they're not available.
So, and we talked about, Sharon, the fact that it's kind of exploding right now. I mean, this is not just, well, it's just exploding. I mean, it's becoming more popular, etc. So give me a sense for what you're seeing, what you all see across the country.
So roughly about 80% of employer groups are now saying that they want to incorporate this into their wellness and benefit plans as a way to access care, which is key, as well as we're seeing the provider community say, I want to be more accessible to my patient population, and how can I do this? This is the way to make it happen.
And I know we had a couple of questions and feedback come up. Well, actually, there were some anecdotal stories that came up about people using it. Do you remember? I mean, like there's, Dan in the back was talking about his kids, and he has, some things that just pop up, but others that are more, an asthma child, etc. And what are you seeing with that type of utilization? And where people are starting to gain comfort.
Right. So once they actually experience it, utilizing it for themselves, they'll end up saying, hey, I can use this to treat, for example, a younger child. A lot of times, roughly about 80% of symptoms have occurred in the past. And when you share that clinical information and a diagnosis can be made, and it's convenient from the privacy of your own home, it kind of catches on. As well as a lot of folks ask me, well, how much of the visits or utilization are turned away to a different setting of care? And that happens basically 2% or less of the time. A lot of people know what symptoms they have, or they've experienced them in the past, and they kind of self-diagnose them, and they want confirmation of what they are experiencing. And again, just having the technology to be able to connect to somebody, that instant gratification, it reinforces behavior.
Well, and I guess I shared at the end, I mean, the thinking about wellness, how it correlates. Wellness used to be, hey, we're going to save money, and now it's more about we want to take care of people, or we want to show them we love them. And with telehealth, it seems like initially people thought, well, it'll save money, and now it's really, we're starting to hear from employers that it's more about convenience and access and that type of thing.
So true, as well as you're seeing the networks that are being offered virtually expanding to include behavioral health professionals, and it's just going to keep growing.
So I know we talked about some health plans. So if you've got an insured health plan, they build it in. So Anthem, Humana, United, but also self-funded plans are now looking because of that access and ease of use. But you all are an example, and there's others that I think you can just put it in. You don't have to be part of a system.
Right. So Live Health Online is available to everybody, and the reason why we did that is because we wanted to be able to provide affordable health care to the entire population, not just the Anthem population. So anyone can use it. And again, they would just be responsible for the payment of the visit. So again, it provides great access to care, just like you said.
Awesome. So I know there's a questionnaire that you talked about that we're going to post on our website. You'll be able to access that just to be able to give you questions to think about when you're looking at a potential provider. So Sharon, thanks so much. We appreciate you, Sharon, coming down from Cleveland to do that. Thanks. If we missed you this time, we'll see you third Thursday of each month at Baptist East Milestone.
Cut.
Thank you.
Thanks, Matt.